So just want to say a big, huge welcome to everybody, and looking forward to a very interesting webinar, and apologies for the late delivery in this session. I know it was due to start before Christmas, but we're more than delighted to have Katy Sutcliffe here today with us, well, in London. Katy works in the Epicentre in the Institute of Education in UCL, University College London. She has masses of experience in the area of evidence synthesis, and she has masses of experience in evidence synthesis informing policy. And I hope that's okay, Katy. I'll hand you over, and if anybody has any questions, please submit them. We'll leave them till the end of the session, and then we can ask Katy questions then. Okay, thanks, Katy.
Thank you, Catherine. Thank you very much, and thanks to the Quest team for inviting me to give this webinar today. And what I'm going to be talking about is qualitative evidence synthesis and its utility for understanding, designing and evaluating trials. So the work that we do at the Epicentre is we undertake and have undertaken a huge number of systematic reviews. We also provide, we also work on developing systematic review methods, as well as providing training and additional support for teams undertaking systematic reviews. I'm going to be drawing on some of the methodological work we've done in the area of qualitative evidence synthesis. So just to give you an outline of the kinds of things I'm going to focus on today. In the first part, we're sort of going to go back to the first principles of evidence synthesis to kind of take you through how we developed and why we developed methods for integrating qualitative evidence in systematic reviews of trials. And then to take you through, in particular, a bit more on the logic and methods of qualitative evidence synthesis specifically. And then I'm going to use two examples to kind of illustrate the utility of this kind of work for understanding trials and informing policy and practice decisions. And then just at the very end, I will hand over to Catherine to tell you a little bit about qualitative evidence synthesis that she and her team are undertaking on factors that impact on recruitment to trials in healthcare. So many of you will be familiar with the concept of systematic reviews, but really to underscore the point of the webinar about why qualitative evidence synthesis is an absolutely vital, a very useful component or approach. Sort of wanted really to take you back, as I said, to these first principles. So this quote here, policymakers and practitioners who intervene in the lives of other people not infrequently do more harm than they do good, comes from Ian Chalmers, who was one of the founders of the Cochrane collaboration, which is now an international systematic review organisation. And comes from kind of the underlying principles or purpose of systematic reviews to inform policy and practice in aiming to do more good than harm. And Ian Chalmers cites the example of Dr. Benjamin Spock's best-selling, record-breaking best-selling baby and childcare book, in which Dr. Spock recommended back in 1966 that babies should be put to sleep on their front. And his logic that he explains in the book is that this would help to avoid choking. And this apparently, at the time, rational advice we now know led to thousands, if not 10,000s, of all avoidable deaths through sudden infant death syndromes. So that's the purpose of systematic reviews, but just kind of stepping back a bit as well to think about how do we go then about assembling evidence to ensure that we're making the correct kinds of decisions in policy making, or safe decisions in policy making. And this example comes from Ben Goldacre, who says that instead of just mooching through the research literature, consciously or perhaps unconsciously picking out papers here and there that perhaps support our pre-existing beliefs, we take this very scientific and systematic approach to the process of looking for scientific evidence and ensuring that our evidence is complete and representative as possible of all the health research or all the research that has ever been done on this specific issue. So that's the rationale behind using the systematic review approach. And in this slide, we have an illustration of kind of the process of a systematic review. So bringing together findings from multiple studies allows us to have increased power, generalizability and precision of our findings. And then the funnel or the systematic review process is designed to ensure that we avoid drawing wrong or misleading conclusions. And it attempts to do this by ensuring that we're not sort of corrupted by biases in the primary studies that are going into that review, or potential biases or problems arising from the review process itself. And the key strength of a systematic review is that it's a transparent approach. So in writing a systematic review report, we're very clear about why we've done what we've done and how the methods that we've selected and how we've come to the conclusions that we do, so that users or readers of that systematic review can have confidence in those findings when implementing them. So just to bring you back to the context in which we've been undertaking systematic reviews at the Epicentre, we have a large programme of work undertaking reviews for the Department of Health and Social Care in England. And so the diagram over on the right-hand side of your screen illustrates our relationship with the department. So at the bottom you can see us, the reviews facility, the research team we have at Epicentre UCL, and at the top we have the teams who are working on policy and developing policy, and in between that we work with the Department of Health policy research programme. So we have this long history of working with the Department of Health and with policymakers, and over that time we've developed a sort of keen understanding of what policymaker needs are. We've also come to understand that in developing policy and in making policy decisions, research evidence, oh, excuse me for the sound effects there, that research evidence is just one small factor in a whole range of possible influences that impact on decision making, such as lobbyists and pressure groups, available resources, including the input of professional expertise in there, and political judgment. So we've put a lot of thought developing that understanding of policymaker needs and also the different influences on policy decisions. So we've put a lot of thought into how we can produce reviews that are more relevant and useful, and thus have greater purchase in that crowded field. So early work that we did in the reviews facility undertook reviews of effectiveness, what we might consider to be our standard type of systematic review, of which many, for example, Cochrane reviews use that model. And so here we have an example of a forest plot from a systematic review in which a pooled estimate of effect, so that black diamond at the bottom of the screen, represents the pooled findings from each of the different studies in that review, the findings of which represented by the little red dots with whiskers. And in this example, it's the pooled estimate of effect tells us what we know on average from studies that have looked at children's participation in structured arts activities for improving their cognitive learning outcomes. So we can see that on average, these kinds of programs are having a favourable impact. But over time, working with policymakers, I mean, they were generally positive about us producing this kind of evidence, but they wanted more assistance than that kind of straight translation could provide. And they came to us with much broader questions about, what exactly the nature, for example, in this example, is the nature of structured arts activities. So if I'm developing policy or commissioning a program, which elements of those structured arts programs should I make sure that I'm doing? What groups of people does it work best for? Will it work in my context? And a whole range of other questions, including why do some structured arts activities seem to work better than others? And also key policy questions about implementation. So how should I go about implementing these kinds of programs? So in thinking about that, we realized that we needed to kind of push the boundaries of these straight systematic review methods to try to answer those questions. But we also began to realize that it's not just the complexity of the types of questions that are being asked. The kind of interventions that we were looking at, public health interventions, were typically complex in and of themselves. They involve multiple and potentially interacting components. And in particular, that those interventions that involve people can be particularly complex, that the impact of those types of interventions are affected both by the nature and beliefs of the person providing that intervention and the person receiving that intervention, as well as a whole host of other potential contextual factors that may shape the outcomes of an intervention. And when working with trials, we found that trials themselves didn't lend themselves to analysis of that type of complexity, generally because there was often a lack of information about that complexity. So Tammy Hoffman and Paul Glatziou have been for many years looking at trying to get trialists and systematic reviewers to be clearer and provide more detail and structured information about the content of interventions. And early work that they did looking at the quality of intervention descriptions, they concluded they were largely remarkably poor. Others have commented on trials often failing to provide useful information about processes and mechanisms. And yet others have argued that, particularly in the case of controlled trials and randomized controlled trials, which seek in their method to kind of disassociate the impacts of the intervention from other perhaps confounding contextual factors, that trial researchers looking at complex interventions are often reticent in articulating and reporting the influence of those contextual factors. So we were able to conclude that, working with trials alone would be insufficient often in the context of looking at complex interventions. So just to conclude that kind of initial section of the webinar, policy questions are often more complex than simple effectiveness questions. And that interventions themselves are often complex with multiple components and affected by context, and that in this scenario, evidence from trials alone is often insufficient to address these complexities, which is where qualitative evidence synthesis comes in. So I'm not going to focus in a huge amount of depth on the methods, but more about the logic and the usefulness of this approach. But if you're interested in how to do qualitative evidence synthesis, there's some really excellent papers out there. James Thomas and Angela Houghton have done a lot of work in this area, as well as I'd recommend, if you're interested in metaethnography, Nikki Britton's worked example. But sort of thinking through then, what do we mean by qualitative evidence synthesis? So essentially, much like a systematic review, but it's drawing together not trials, but studies of people's views and experiences. And the purpose is to understand health and social issues or experience of interventions from the perspective of people under study. And just like any systematic review, it aims for both rigour and transparency, and just like any systematic review, the aim is to help support policy and practice decisions. And again, much like any systematic review, it follows a similar set of stages, such as developing a conceptual framework and inclusion criteria and systematic searching for identifying relevant studies. Although there is some question over the appropriateness of quality appraisal of qualitative studies in systematic review. And if you're interested in that issue, Ruth Garside's 2014 paper covers and touches on those issues. But that said, although there are many similarities or much similarity between qualitative evidence synthesis and the more standard systematic reviews looking at the effectiveness of trials, there are some clear and distinct differences. Kind of fundamentally or philosophically speaking, they're pretty divergent in where they're coming from, with the effectiveness synthesis coming from a much more realist end of the philosophical spectrum, and qualitative evidence synthesis much more towards the idealist end of the spectrum. But also in relation to theory, the purpose of systematic reviews varies. So while the effectiveness type of systematic review aims to test theory about the effectiveness of a particular intervention, qualitative evidence synthesis is much more concerned with developing or generating theories that explain perhaps what's going on in an intervention, or perhaps what people's experiences are. And the approach to synthesis then is very different. When we're seeking to test theory, we are looking to aggregate or to sum up the findings of multiple studies in order to, for example, to ask the question, what works on average? Whereas in qualitative evidence synthesis, the aim is to configure findings rather than to sum them up in order to explore and understand the diversity or perhaps similarity of experiences. And because of these different aims and approaches and philosophical underpinnings, while one of the strengths of effectiveness synthesis is that methods are stated in advance, so we would produce a protocol and we would declare exactly what the types of interventions we were looking for and the types of outcomes we would examine and how we would go about that, setting out in advance exactly how we would approach the review. For qualitative evidence synthesis, we can be a bit more relaxed or work more iteratively, because we're seeking to generate theory. The concepts that we're dealing with are much less well defined, and therefore we need a little bit of wriggle room to move around and to be able to say we need more, evidence of this type. So our searching for an effectiveness synthesis, we aim to have an exhaustive search. As Ben Goldacre said, we want our research to be as complete and as representative as possible. For qualitative evidence synthesis, we may draw on theoretical searches to ensure that we get representativeness of a range of views, although it may not be exhaustive. In terms of quality assessment, as I've said, this is a contested area for qualitative evidence synthesis, and rather than seeking to avoid bias or identify errors in the trials that inform an effectiveness synthesis, when we're doing quality assessment for qualitative evidence synthesis, we're perhaps taking a slightly different approach. And the products as well will be different, so we're providing kind of increased precision and magnitude in our pooled estimate of effect, whereas the product of a qualitative evidence synthesis looks entirely different. It's kind of theory-based and looking at emergent concepts. So, moving on to look at the process of doing the synthesis part of qualitative evidence synthesis. For those, many of you who will be familiar with undertaking qualitative primary research, the way that we gather and synthesize evidence feels very similar to that kind of analysis. And one of the methods that's key is for synthesizing qualitative evidence for multiple studies is thematic synthesis, but it's very similar to other methods of QES, so meta-ethnography and framework synthesis or other methods. But what I'm going to focus on in my example are instances of thematic synthesis. And there are generally 3 stages to this, and as I go through the examples, you'll see a bit more about that. Okay, so moving on then to the examples. So this first example is from a systematic review we did a very long time ago, and I was involved in on examining barriers and facilitators of interventions to support healthy eating among children, and in particular to encourage the consumption of fruit and vegetables. So this slide illustrates kind of the different components of the review, and it can be seen as what we might call a convergent type of mixed methods review. So you can see that we had our initial review question: what is known about the barriers to and facilitators of fruit and vegetable intake amongst young children, so aged 4 to 10 years. And we did our systematic searching and screening, and we identified a huge number of studies, but we narrowed down to look at 2 sets of studies. And one of those sets was the qualitative studies, of which we had 8, and we did apply inclusion criteria, but also some quality appraisal questions and to that work, and we synthesized the evidence. But alongside that, at the same time, we did an effectiveness synthesis looking at 33 trials of interventions aiming to improve or increase fruit and vegetable intake amongst children. And we did those 2 pieces of work, if you like, side by side, and then we brought them together. They converged finally in a 3rd synthesis where we brought the evidence from the view synthesis and the trial synthesis together. Okay, so here's the forest plot, or one of the forest plots from the effectiveness synthesis, illustrating that there's a small increase in fruit and vegetable intake on average when we look across the studies that measured whether interventions increase fruit and vegetable intake consumption. And so that when that work was done, the questions for our qualitative studies, our synthesis of qualitative studies, were around what are children's perceptions of and attitudes towards healthy eating, and what does healthy eating mean for children. So it's really getting at this kind of configurative type of work, understanding and meaning. We also asked, what do children think stops them from eating healthily? What helps them to eat healthily? But we also looked to see if children in these studies had expressed ideas about what could or should be done to promote their healthy eating. So the stages of these 3 stages of thematic synthesis, stages 1 and 2 are around developing descriptive codes and themes. So we extracted the results of each of these primary qualitative studies, and the first stage we did some line-by-line inductive coding, so coding every single piece of text, and we're looking here both at text which is quotes from the children directly themselves that were involved in the studies, but also when we're doing evidence synthesis level work, we are including what we might call second order interpretation. So if the children's own statements are first order interpretations of this phenomenon, we're also taking the authors of those studies, analyses and interpretations as data for our qualitative evidence synthesis, and that's conceptualized as second order interpretations. So all of that data was captured, and from that we developed 36 initial descriptive codes. In the second stage, we looked at those codes and that work in order to try and bring them to a kind of a higher level of kind of grouping and categorization. And so we developed from the 36 descriptive codes 13 initial descriptive themes. So taking you back to the first step, you can see here highlighted in yellow some examples of the kind of text that we were seeing. So in the middle of the screen, the middle bit of highlighted text, one of the participants in this study says, all the things that are bad for you are nice, and all the things that are good for you are awful, meaning i.e. that they taste awful and are not palatable to children. So you can see how we began to use the software to code that as a descriptive code. And then here you can see how we organize those descriptive codes into our descriptive themes. So these themes represent what we were seeing in those studies. So you can see there's things around children's understandings of what healthy eating means for them, notions of health consequences and good and bad foods. There were a lot of themes about how foods are provided for children either in the school or in the home. And for example, in school, people talking about school dinners as being quite a social occasion for them, and that had an important element for children. As well as looking at foods in the home and perhaps breaking the kind of rules in the home and asserting their independence in food choices. And then they also talked about choosing foods, and they talked about, for example, their own food preferences, the kind of things that they liked, but also their awareness of this knowledge behaviour gap. They're aware of what was healthy, but that wasn't the choices that they were making. So the third stage is the important sort of key stage of thematic synthesis in relation to developing answers to inform policy and practice. And what this entailed was further analysis of our descriptive themes, but in the light of our specific review question, rather than in the light of what the original studies were telling us. So up until this point, effectively, we hadn't got any results. Our analysis didn't address our review question. It was a synthesis of the studies in their own terms. But we were able to then use those descriptive themes in the light of our own question to develop this third stage, which is our analytical themes. From the themes, essentially we inferred what the barriers and facilitators of healthy eating among children and what children's recommendations might be, we would infer it from what they said, for interventions. So here are our analytical themes, which again are drawn from the descriptive themes. So one of the things that was kind of indicated in what children were saying is that they don't really see it as their role to be interested in health. That's something for adults to consider, and it's not their problem. Their problem is to kind of eat the kind of things that they like. They're also quite clear, for example, we could infer that children don't see future health consequences as personally relevant or credible. So, for example, those people interested in promoting children's health obviously felt it was very important to share knowledge about the relationship between diets and health and future health consequences. But the young people didn't see this as of interest or relevance to them. And then in turn, we were able to develop some recommendations. So you can see here on the right-hand side of the screen, we inferred that rather than emphasising the health properties of fruit and vegetables, it would perhaps be better to infer that they're tasty. And in interventions, to promote healthy eating among children, it actually might be preferable to reduce the emphasis on health messages. So we had some quite surprising findings, if you like, and this is really the value of qualitative research, as I'm sure you're aware, but also in a qualitative evidence synthesis. And then, so bringing to our kind of convergent review, where we tried to bring together the findings of the qualitative evidence synthesis with the findings from the trial synthesis, we looked to see how many of those trials met those recommendations. So, for example, one of the findings was that whilst children were very keen on fruit because it's sweet and tasty, they didn't feel quite the same about broccoli. And so one of our recommendations was to promote fruit and vegetables separately rather than in the same way. And we looked across the interventions to see if any interventions had done that, but actually all of the interventions we'd identified lumped fruit and vegetables together. And coming down to the bottom though, the other recommendations, we could see that there were some outcome evaluations that did follow those recommendations. So for example, one of the recommendations was to reduce the emphasis on health messages, and particularly those which concern future health. And we found that we had, amongst our 33 trials, 5 soundly evaluated interventions and 5 which didn't kind of meet our criteria for soundness, but also had reduced the emphasis on health messages in their interventions. And when we brought the findings together, what we could see was that, and we don't want to overemphasize it, but where those studies had little or no emphasis on health messages, it certainly didn't do any harm in terms of their outcomes. So you can see that on this diagram that those interventions marked in red as opposed to blue are those ones where there was little or no emphasis on health messages and had an increased or had kind of the best results out of this set of studies in terms of increasing vegetable intake across the trials. So I'd like to now move on to a second example, which was done more recently and was undertaken in the wake of a really comprehensive review undertaken by NICE about weight management programs for overweight adults. And what we're talking about here, the technical term is Tier 2 weight management programs. We're talking about things like Weight Watchers or Slim and Well that you'll be familiar with, as well as health service provided similar type of interventions. But NICE, National Institute for Care and Excellence in the UK, had undertaken meta-regression and ultimately had concluded, despite trying to find out what were the key ingredients of weight management programs, that the factors that differentiate more effective from less effective interventions were largely unknown. At which point we were commissioned to take an alternative approach by the Department of Health, and we used different methods, but we also want, including qualitative comparative analysis, but that's a whole other webinar. But one of the things that we did was to locate our analysis in a qualitative evidence synthesis. And so in contrast to the previous example, this systematic review or mixed methods systematic review can be seen as a sequential type of review. And I refer you to, if you're interested in the convergent sequential types, the work of Ploy and Hong. They've done lots of work in the nature of mixed methods systematic reviews. Essentially, we undertook a qualitative evidence synthesis which informed very directly the way in which we undertook our evaluation of trials, with the aim to identify what the critical features of successful weight management programs for adults are. Okay, so this is a kind of a diagram illustrating the results of our qualitative evidence synthesis in response to the question, what do service users and service providers feel are the critical features of weight management programs? And the kind of headline, or in a nutshell finding really, was people were saying that positive relationships are absolutely fundamental to the success of these types of programs. So that would be relationships between the participants in the program, as well as relationships between the participants and the providers of the program. But why this particular review was especially helpful was from that qualitative evidence synthesis, we were able to get beyond not just what people felt was important, but how and why. So in the purple boxes in the diagram, I hope you can see those. So it's this kind of second row down where we're looking at the weight management program components, but also that they contain what the mechanisms of action were. And in the top row, what we have is kind of the outcomes that people were describing along the pathway to successful weight management. So at the first stage, the participants in the study were describing that provider and peer relationships are absolutely fundamental to getting them to attend the weight management program, to turn up. And the mechanisms that supported that attendance in the program were having an opportunity for social support, given that having overweight and obesity is associated with huge amounts of stigma, but it also provided an element of fun and a safe space to be with other people in the same situation. So people were keen to attend these programs to access these types of relationships. And then that attendance and turning up week after week to your program enabled people to, those relationships between providers and peers and the program attendees began to develop. And those developing relationships led to a sense of accountability, as in, I can't let the team down. I've got to make sure that I do my steps this week because I don't want to turn up and tell my mates that I haven't done it, or I don't want to tell the program provider that I haven't managed to stick to the diet this week because we've got a friendly relationship here. So that developing relationship and the developing sense of accountability enabled people to begin their journey in terms of adopting healthier behaviours. And that initiation in turn led to a feeling of self-efficacy. I can do this. I didn't think I would be able to play football, but I can do it. I didn't think I'll be able to do these kind of steps, but actually I can do it. And that experience, actually, I'm not only able to do it, I'm enjoying it. I'm seeing my blood pressure come down. I'm seeing the weight come off. I'm finding myself running up the stairs, which I haven't done in years, and messing around with the kids. And that final stage of experience of the benefits of healthy eating and exercise is what led to that longer term self-regulation. So you can see the pattern of the relationship between the component of these important relationships and the mechanisms of action there, leading from, in the early stages, these extrinsic motivators to the ultimate intrinsic motivation to self-regulate your weight over a long time. And you could also see that over time, the level of service input provided kind of reduces. Okay, so that's kind of an overview of what we found from the qualitative evidence synthesis. And now, then we use that information to develop a coding tool to look at the content of interventions in a number of trials. And to do this in this qualitative comparative analysis approach, what we did was we, from the original NICE meta-analysis, meta-regression. They'd identified 40 trials of weight management programs. And what we did was we took the 10 most effective in terms of weight loss at 12 months and compared them to the 10 least effective interventions after 12 months in terms of weight loss. And we asked the question, so do those user and provider views about what's important explain the differences in outcomes between those most effective and least effective? And we found we did. So this is a kind of a summary table from our report where we're looking at, we looked at a number of critical features, but this fundamental one about the quality of relationships. This is about the relationship between service providers and service users. And people did say things like, it's really great to work with, from my weight management program because I feel that somebody's battling for me. I feel I've got some support. And the quote underneath in this second column is this kind of second order interpretation. So this is author of one of the studies who concluded or interpreted that the personality and approach of the advisor is likely to determine the success or failure of the service. So you can see that's the kind of thing from what the studies were saying. And then we compared in the next column the 10 most effective interventions, and we found that all of those interventions had both an emphasis or an opportunity to develop those provider-user relationships and characteristics perceived to foster self-regulation. And on the other end of the spectrum, we had those least effective interventions, and all 10 of those either had no emphasis on provider-user relationships, or they had some emphasis on that, but no, and this was another kind of important component that but haven't emphasised it so far, about getting, the kind of the components of an intervention that kind of help to develop that self-regulation for long-term outcomes. But so, we were looking at combinations of features here, but we could see a clear difference based on what we were getting from the qualitative evidence synthesis between most effective and least effective types of interventions. And now this slide, the text is very small, you don't need to read the text. It's kind of deliberate to show what's going on, but I think it's a really nice example of absolute value of qualitative evidence in understanding trials and getting, it comes back to that kind of philosophical perspective, getting a very different and alternative perspective. What this is the intervention description lifted from a trial report of one of these 10 most effective interventions. And all the text in black is the kind of technical detail about how many calories per day and the kind of diet plans and exercise plans that they followed. But these little bits in blue represent the information that we had on which we kind of inferred that there was some kind of support for developing user-provider relationships. And so the first bit in blue says strategies to manage the barriers to change and dietary concerns identified by the woman were established jointly. So there's some kind of dialogue there. Counselling was provided at the research clinic, and follow-up counselling was provided at the homes of the women. So people came to visit you at home. So there's an opportunity to talk with somebody on a one-to-one basis. The second bit, so there's different descriptions for the diet component of an intervention as well as the exercise component of an intervention. So the second text in blue says counselling and follow-up were provided at the homes of the women, and on both occasions a physiotherapist joined the women on their walks, ostensibly to ensure suitable walking paths, but we inferred that going for a walk with somebody for an hour gave you an opportunity to develop a relationship. And this particular study was, as I say, one of our key highly effective studies, but it did also contain a qualitative process evaluation. It was one of the very few that did, but we weren't able to include the qualitative evidence because it didn't come from the UK. And so we came across this after we'd done our analysis and our synthesis of qualitative evidence. But this is what people in this intervention described as the important points. the energising interaction between the healthcare provider and the patient being key to successful initiation of change. To overcome initial barriers to weight loss, the women needed a catalytic interaction from the care provider, which was built on an emotional bond through joint commitment, trust, and accountability. So coming back to that point, that often working with trials alone to determine what's working in complex interventions, the kind of information that's provided just isn't sufficient. I don't think anybody would have concluded from this intervention description that the key component or critical factor was a relationship or an emotional bond, or joint commitment or trust and accountability. So it's just a nice example of the kind of information that qualitative evidence provides and how it can be really critical to understanding the effectiveness of trials. So just in summary, qualitative evidence provides this alternative perspective, insight about how complex interventions are experienced. So it's providing insight about why interventions work and their underlying mechanisms, explaining why interventions sometimes don't work as expected. But some of the features that we've identified were unanticipated. We wouldn't, as adults in the example of the children and healthy eating, I don't think any of us interested in supporting children's health would have thought the idea of reducing emphasis on health messages would have been a good idea from the outset. It took that experiential knowledge from the perspective of children to illustrate that. But also hidden features. So, for example, in the weight management example of the intervention I've just described, the focus on those relationships was really minimised, squashed. It was at the end. It was also, almost as if it was almost hidden, and we wouldn't have picked it up had we not been looking for that qualitative evidence or basing our analysis of the trials descriptions from our previous analysis of qualitative evidence. But they also perhaps, the qualitative evidence synthesis has in many occasions that we've done it, emphasised what interventions are not doing that they could or should be doing. And then this kind of synthesis of evidence across study types, bringing together the qualitative evidence with the trials at a synthesis level, helps to bring together work from these epistemologically diverse disciplines, bringing together these different worldviews about what is important. Okay, so before we head to questions, I'm just going to hand over to Catherine to tell us a little bit about her current qualitative evidence synthesis on factors that impact on recruitment to trials in healthcare.
Okay, thank you very much, Katie, and I'll talk to you about your own presentation in a few minutes. So I just wanted to briefly introduce Quest's ongoing qualitative evidence synthesis registered with the Cochrane database of systematic reviews, looking at the factors that impact on recruitment to trials in healthcare. For those of you familiar with Quest, you will know that one of our primary aims is to conduct primary research on trial methodology using qualitative methods. And this is one of the big projects that we're working on at the moment. So there's a team of us from Quest. There's also Jane Noyes from the Cochrane Group, and Sean Truick and Heidi Gardner from Trial Forge in Aberdeen. And also Katy Sutcliffe that we have here today, who has been critical to the group in terms of advising us on methodology, and we'll always be grateful to you for that, Katy. It's ongoing, so I don't have any slides really or anything that I'm willing to share with everybody yet, but just to kind of link in with the area of trial methodology and what Katy has already explained to you about qualitative evidence synthesis. One thing that stands out in my mind as you were talking, Katy, was the idea of the iterative nature of qualitative synthesis. We registered this protocol looking at recruitment to trials from the perspective of both recruiters and participants. Having done our search and having done our screening process, what we realized is there's actually an awful lot out there from both of those perspectives. And it was necessary for us to narrow that down So we are only looking at potential participants at the moment, be it somebody who's accepted to partake in a trial or those who have declined, with the view to doing a subsequent review possibly later from the recruiter perspective. We have we are currently at the stage where we have completed, we're using thematic synthesis, as Katy has already outlined, and we are at the stage where we have developed our interpretive themes. Two of the team have just come back from Aberdeen, where we met with Sean Treweek and Heidi Gardner, who have conducted separate intervention reviews, also published within Cochrane. So non-randomized interventions to improve recruitment and randomized interventions to improve recruitment. And the idea is that we integrate the findings from these three reviews to form what they have coined as the Trinity package. And you can learn more about that on the Trial Forge website. What we learned from the trip to Aberdeen, and it's again something that Katy has already alluded to, is that what we are hearing and finding from the participants themselves, or the potential participants rather, are that the issues around why they decide to take part in a trial are very, very different to what's already ongoing in terms of recruitment strategies and recruitment interventions. So what we would hope for as the work progresses is that we will be able to present a table similar to Katy's one looking at healthy eating, whereby we can map interventions that link in with what our findings say, but also making recommendations. And this is the key point here, making recommendations about how to improve recruitment and also further interventions and further research that needs to take place. And that's where we're at really with that. And like I said, it links also in with the newly published priority study that looked at the top key priorities for recruitment. And we hope that this review will answer at least two of those questions. And also the ongoing work looking into retention in trials as well. And you will see that qualitative evidence synthesis would have a key role in that as well. So that's just an overview of where we're at the moment with that review. Is that okay, Katy?
Yeah, no, that's really helpful. Thank you. So I think you've been monitoring, Catherine.
Yeah, okay. So you finished your presentation now, Katy, so we'll start to look at the questions. Firstly, from my own perspective, I just wanted to thank you and say that it was really valuable for anybody interested in qualitative evidence synthesis, but also anyone who's tried to feed a 5-year-old piece of broccoli. So there's loads to be learned from that perspective as well. I just also, before we begin the questions, wanted to thank the Irish Research Council as they provided funding through their new foundation schemes for this work and for this knowledge exchange between ourselves, Trial Forge, Sean Treweek and Heidi Gardner, and also Katy at the Epicenter. So I just wanted to acknowledge that. Oh, and there's also a nice thank you slide there from Katy. So we have two questions currently that I would like to ask. One of the attendees online has asked if you have any advice for people doing qualitative evidence synthesis who are very eager to stay true to their qualitative paradigms, reviewing studies that may not seem as qualitative as they would like. So I suppose looking at the area of critical appraisal, maybe, Katy, and the fact that sometimes the studies that you read may not be of the quality that you would hope for.
Yeah, I mean, there is this debate around whether it's appropriate at all to appraise the quality or relevance of qualitative evidence. But I think it can be really helpful to readers if you're able to kind of illustrate the ways, the richness of the evidence, but also the kind of approaches that individual researchers have used to gathering that evidence. Have they taken an approach which kind of is really respectful of the participants, allows them to have control over what is discussed, so that what we're getting to is to some the kind of findings of the qualitative study really do reflect people's own beliefs. And for example, in the instance of working with children, recognizing power differentials, for example, between adults and children, and trying to take steps to overcome that so that children are able to speak freely and critically. So making using quality appraisal tools to make clear those types of issues, I think it to my mind, it is really important. And there are many tools available to do that, but you can, select those ones to kind of address the issues that you feel are important and explain why you've selected a particular research or critical appraisal tool to do that. But as I said before, there's work by Ruth Garside discussing those issues, and some original work that we've often drawn on, which was from Angela Houghton, but I don't think it's ever actually been published, but it's sort of hidden in some of our earlier reviews, including the review on fruit and vegetable intake for children, which is available on the Epicenter website, includes the framework that was used to appraise those qualitative studies, and it addresses those kind of fundamental issues as well.
That's lovely. Thank you, Katie. There's another couple of questions here. So one person has asked a question about what software do you use in the diagrams that you presented today? So I'm guessing possibly a brief discussion around Epi Reviewer.
Yeah, so the Epi Reviewer software does have capacity to do this kind of qualitative analysis and coding, but it's very similar actually to typical software packages, NVivo, etc. So if you don't have access to Epi Reviewer, which is kind of a systematic review software, and it does everything from meta-analysis to this qualitative synthesis, but in fact for the healthy eating and fruit and vegetable review, going back a huge number of years, we did actually start off using NVivo to do that. So I think over time, Epi Review has developed the kind of capabilities that NVivo has. And I haven't used NVivo for a long time, and I'm sure there are other packages as well, but either or a qualitative analysis software package would work just as well as Epi Reviewer would.
Thanks, Katie. And as you know, on the recurrent review for Cochrane, we're using NVivo, and I guess it's what you're comfortable with and familiar with as well. Yeah. And maximizing the tools available on those software packages, there's so much to offer in terms of modeling and tools and queries and things that people perhaps don't utilize as much as they could. Thanks. And there's another question about how many people should be on a team. And I guess this is a nice question because it also refers to topic expertise and methodology expertise. As I mentioned, Katie was invited onto the Cochrane Review for her expertise in qualitative synthesis, but we also needed people who had the experience in recruitment to trials as well. Katie, have you anything to add about the magic number? How many should be on the team?
I would say, obviously, you do need at least 2 for doing a systematic review. And my experience is, and I don't know what you think, Catherine, is that having too many on a team provides a challenge. So the initial steps of line-by-line coding, etc., can be done across a broader team. But those kind of really deep analytical stages and those thought processes, it is really useful to have quite a small team of 2 or 3 who are really immersed in the studies and in kind of the data, so that you can begin to you can really discuss in some depth what's going on. But having the kind of multiple participants doing the work initially independently, so that you kind of being quite explicit, and there's some kind of quality and robustness to what you're doing is useful too. But yeah, I would suggest that trying to use a large team to do this actually could be problematic. And as well, similarly, having too many studies in your qualitative synthesis can also prove challenging. And there are ways around that, but sometimes less is more, in terms of being able to get that depth of analysis, looking to getting at the stage of identifying mechanisms of action, etc., takes quite a depth of analysis. So small teams, small numbers of studies help with that, but obviously it depends on what you've got to work with, and your funders, commissioners, and what their interests are as well. I don't know what else, if you wanted to.
No, that's great. It's that's exactly what I would have thought myself. I just wanted to ask one more question. It's a bit more of a biggie, and it comes from Bernard here in the room. He was just looking for advice on selling the need for qualitative synthesis in addition to systematic review with governments and departments. And I think this is coming from an Irish perspective where we would probably not have the same culture of using the type of work that you do to inform policy and practice.
Yeah, I recognise the the frustration. We've been really fortunate, I think, in that we have, as I was describing early on in the thing, this really long established relationship with the Department of Health and team members that have been involved within the epicentre for a long time. So we were able to work with them to build up this level of trust, if you like. So when they came to us, and you know, there's a recognised appreciation of the kind of contribution that systematic reviews of effectiveness provide. But when we were really having to push the boundaries of systematic review methods, and that was quite challenging. People from all sides did question it, but because we had this long established relationship with them, that really supported that. I think certainly attitudes are changing. I think, Catherine, your work with the Cochrane collaboration is one of only still a handful of qualitative systematic reviews that they've kind of supporting, but it does show that kind of there is a change, a tide is turning in terms of accepting and recognising the value that qualitative evidence can bring, and we're all still championing that cause, but I do recognise that it's sometimes a challenge.
Thank you, Katie. We've just got a comment in here from one of our viewers that says the most recent WHO guidelines on care during labour includes recommendations arising from a QES. So as Katie says, change is afoot, and hopefully there's this growing recognition of what we can achieve through evidence synthesis. And another comment just to say thank you for a very interesting presentation. So it's nice to get that feedback online.
Well, thank you very much, yes.
So is there anything else you'd like to say, Katie, or will I finish off?
Well, just to say thank you for inviting me to do this, and I hope it's been helpful, and yeah.
Okay, and also just to let people know that this has been recorded and will be available on the Quest website as soon as we've figured out how to do that. And I wish everyone